Another day, another tell-all book with a Trump bombshell in it. This time it's journalist Bob Woodward's Rage, in which he reveals the president admitted he downplayed the coronavirus early on. So while he was out in public saying things like this,
"It's going to disappear. One day it's like a miracle. It will disappear."
He was saying this to Woodward.
"It goes through air, Bob. That's always tougher than the touch. It's also more deadly than your strenuous flus. This is more deadly. This is 5 per, this is 5% versus 1% and less than 1%.
I've wondered for months whether the president really didn't know how bad this virus was or was just pretending. I guess now we know. And to this day, he continues to flaunt health and safety advice, as he did again last night at a rally in North Carolina, which violated both the state mask mandate and the 50-person crowd limit.
I don't know how many people here, but there's a lot.
Yeah, too many. The president is also continuing to push the possibility that a vaccine could be ready by Election Day. But already one promising vaccine effort has hit a major road bump. Pharmaceutical giant AstraZeneca paused its late-stage clinical trial yesterday to investigate a potential adverse reaction in one of its participants. It's not clear how long the pause will last, but it's a definite blow to Trump's rosy predictions, especially when this was reportedly on the list of vaccines the president was considering fast-tracking for FDA approval without finishing safety trials. And while the head of the National Institutes of Health and the Surgeon General testified before a Senate panel today that there'd be no compromises on safety in a coronavirus vaccine approval, many are, understandably, concerned about the idea. Of course, vaccines aren't the only thing people are worried about in the federal pandemic response. The CDC recently came under fire for changing its testing guidelines, saying people without COVID-19 symptoms should not be tested, despite the fact that experts say those asymptomatic people are responsible for as much as half of all coronavirus transmission. And that was a bridge too far for many, including former NIH Director Dr. Harold Varmus, who co-wrote a recent New York Times op-ed with the head of the Rockefeller Foundation entitled, "It Has Come to This, Ignore the CDC." Dr. Varmus, the 1989 winner of the Nobel Prize in Physiology or Medicine, I should add, joins me now. Doctor, it's a pleasure to meet you. Thanks so much for being here.
Pleasure to be here. Thank you.
So you're walking on the street in New York City, and a non-public health expert, an average person, walks up to you and says, "I read Woodward's book. I think the president lied to me. I read your op-ed in the New York Times. You say ignore the CDC. Doctor, who am I supposed to trust in the middle of this pandemic?" What do you tell him?
Well, I try to explain why, in this one circumstance, I am unhappy with what the CDC has said. The CDC is a wonderful organization, and it's served this country admirably for many years. But to withdraw support for testing of asymptomatic people, especially at this juncture in the pandemic, is a terrible mistake.
But it's not just, well, you say it was this one issue with this with asymptomatic testing. Let's go down a short list if we can. The head of the FDA not too long ago gave emergency use authorization for hydroxychloroquine before he withdrew it. And then we, of course, know his overplaying the power of convalescent plasma. We know the coordinator of the White House's task force on coronavirus essentially defended the president when he talked about injecting people with bleach. So these aren't just isolated moments. There's a federal government that is essentially deceiving the American people. Where does that busy, average, overwhelmed, scared person go?
I think this is a huge problem because everybody who's a citizen of the U.S. ought to have the sense that public health officials throughout various walks of life, in federal government, state government, local governments, institutions, are speaking the same language with the same purpose. And that's not happening. And I very much sympathize with people who don't have the information that allows them to evaluate what's going on and have to rely on people like me who write op-eds. That's not the way things should be working.
Well, you know, it was also one of the consequences people often say. There's a CBS News poll that came out in the last 48 hours that shows, I think, pretty dire consequences of this public cynicism. Question was, if a coronavirus vaccine became available and was free, would you get it? Only 1 in 5 said they would get it as soon as possible. 58% said wait to see what happens. Who knows what that means? So the consequence of this expanding lack of trust could be dire, could they not?
Yes, no, that's a serious problem. We've had vaccine skepticism for other kinds of reasons in the past. Now I think a lot of this skepticism is based on the concern that we're going to rush a vaccine to approval before the election. That's intolerable to many of us who think that it's a major federal responsibility to be sure that a vaccine has been tested in the usual way for safety and efficacy. I also think that people justifiably want to know what the data look like. That is, how do experts in a variety of fields evaluate what's happened? It is naive to think that a vaccine decision is a yes or a no, that you either have a vaccine or you don't. Vaccines may be very high quality and highly protective, but that may be much less protective. And I think it's legitimate to ask, what is the basis on which a vaccine has received approval from the FDA?
Well, you know, your response almost got me back to the beginning when you said the average person wants to know what the experts have to say. And I hate to be redundant, but who is the expert that I should look to when the vaccine is, quote, ready for me to take it, other than Dr. Fauci, about whom nobody, except occasionally the president, will say an unkind word? I'm serious.
Well, I wouldn't say an unkind word myself. He's one of my best friends, so I have great
Is that true?
Well, he and I served together at the NIH for many years, and he's a remarkable human being, and his word is good for me. But I think that there will be many voices raised, and many voices have been raised, and there are responsible people who have scientific credentials and served the country honorably in the past, who are speaking out on these issues. And I congratulate the press for bringing those voices to public attention, because in this difficult time, it is critical that we have the nation's scientific experts who are or are not in the government to be speaking out.
You know, one of the things your buddy, Dr. Fauci, has said, which also relates to this, is there is I'm paraphrasing, but he said essentially this: there is a troubling anti-science trend in this country. So talking about the public cynicism I mentioned a minute ago, part of it is they're worried that speed is more important than safety, and part of it is that there's this feeling that science is just, you know, another thing to maybe be considered. How do you build that back? I mean, how do you build back a faith in science as opposed to political rhetoric about science?
It's an interesting point, because, you know, it depends on how you ask the question. And many pollsters ask the question about which profession do you respect. And scientists do still enjoy a fair amount of respect in the public domain. They're among the most respected of the professions. But as you know, public cynicism about many revered professions has declined. And I think in this particular environment of the confusion that the federal government seems to represent with respect to COVID-19, people's confidence in science, especially science that is operating within the federal government, has been undermined by what has happened as a result of what appear to be political manipulations of revered scientific and medical institutions.
Was it hard for you to write that op-ed, considering what you've done with most of your life and how close? I mean, the CDC, through most of its history, has been regarded as the most respected public health institution in the world. Was it hard to send that in to the New York Times?
It wasn't hard, because clearly my motivation here was not to damage the CDC. My goal was to try to explain to people why the testing of asymptomatic people is critical for control of the pandemic.
Did Dr. Redfield contact you afterwards?
He did not.
He did not. Last thing, Doctor, if I may, you say that in lieu of the CDC taking a leadership position. I think your final line was something like local, state, and organizational leaders need to do what the feds will not. What is it in our final minute that those local, state, and organizational leaders should be doing?
Well, the states and the localities should do, and other organizations that have the power to carry out tests of asymptomatic people should be following sound public health guidance and being sure that people who are likely to transmit the virus to somebody else or may have received it from somebody else are being adequately tested and followed up to be sure that we get control of the pandemic. We can get control of a lot of it, and these folks do have the authority to do that.
Dr. Varmus, it's a pleasure to meet you. Thank you so much for your thoughts and your time.
My pleasure. Thank you.